condition, chronic condition, multiple sclerosis, and specifically related to aspects of air pollution and how that may impact multiple sclerosis here in New Brunswick. So this project actually is what brought me to New Brunswick, this area of focus, to study multiple sclerosis here and do some research, and has led me to stay in New Brunswick. But an important thing to note about New Brunswick and multiple sclerosis is we have very little research here in the province, as well as we have quite a high rate of multiple sclerosis. And so it was quite of an interesting opportunity to come and work here in New Brunswick to study this interesting disease. So the title here is slightly different than what you may have seen, but it's all the same presentation. Oops. All right, so just getting into a bit of a background. Okay, so multiple sclerosis, it's a disease of the brain and the spinal cord. And so what you see here is a bit of a caricature of a neuron. And so our neurons are cells that are housed within our brain and our spinal cord. And we have billions and billions and billions of them just within our brain. And so the way that the neuron works is it sends our electrical signals through our body. And what it does is it has these fat cells around the neuron, or the axon of the neuron, and the electrical signals, so our thinking or moving our hand or what have you, these signals jump so they can be done really quickly. And so the idea of jumping enables the electrical signal to be sent very quickly. In multiple sclerosis, unfortunately, the disease is a disease in which the body, or the body's own immune system, appears to be attacking these fat cells around the axon of the neuron. And so these are MRI images of an individual who has multiple sclerosis, and the white that you see there are representations of that damage to those fat cells that surround the neuron. And while we see the pathology here in these images, this relates to decreased electrical signals that can be sent. So the signal, while it still has to pass through the same location, it cannot no longer jump, so it takes longer. And so in individuals who have multiple sclerosis, as the disease progresses, so they have more of these white spots, which indicates more of that damage, their disability often tends to increase. This is a very commonly used scale in the multiple sclerosis world to characterize that disability, and it focuses mainly on physical disability here, but more recently the cognitive and the psychological aspects of multiple sclerosis and the progression have also been recognized. As you can see, people can go from normal neurological function, and often, not often, but individuals can experience that as their disease progression, where they remain relatively mild disease, but it can also expand to have quite a progressive aspect of disease and leave individuals bedridden. And life expectancy of individuals with MS is also reduced as compared to the general population. So who gets MS? Well, unfortunately, it is a disease of young adulthood. So when we're starting to form our lives and our families, and this tends to impact individuals at this time of their lives. So between the ages of 30 and 50 is usually the peak. I got into the world of multiple sclerosis by studying pediatric multiple sclerosis. So children do get it as well, but it's not very common. And older individuals do also get it, but also, again, not as common as this specific age group. Interestingly, females are 2 to 3 times as likely to get multiple sclerosis than males. They're also more likely to be diagnosed sooner than males. There's also an interesting birth effect, which distinguishes individuals being born in May in the Northern Hemisphere, and in November, which is kind of the equivalent of May for us, in the Southern Hemisphere. Those individuals tend to have greater risk of multiple sclerosis. And it's interesting that it turned out November in the Southern Hemisphere, because the evidence had been primarily in the Northern Hemisphere suggesting this aspect of month of birth. There's a latitude gradient. As further you get from the equator, the more MS you have. So here in Canada, we've got quite a bit given our weather or our distance from the equator. And there's no clear association with socioeconomic status. Long time ago, MS was considered kind of a disease of Caucasians and in upper class types of populations. But as medical services become more available to the general population and more multicultural countries like Canada, we're observing that, in fact, the disease is not strictly for Caucasian individuals, and actually may have to do more with place that you reside in. And so this gives you a sense of the distribution of MS across the globe. And so this tells you how many people have MS in different countries. As you can see, the browny, red, maroon, the darkest color, is in the countries that have the most. And here in Canada, actually, we have among the highest rates of MS globally, and this suggested. And so much so that a number of years ago, the MS Society of Canada put out a campaign, which in Canada here, that spelled out that MS lives where you live, that MS is Canada's disease. We have the most in the world. And so while it's quite striking, it's also interesting to ask why. So across Canada, we also have a bit of a distribution of multiple sclerosis. As you can see here, there are several estimates that have been published in the past. So we have got some evidence from BC, which seems to have a lower rate of multiple sclerosis as compared to the rest of the provinces, as you can see. The evidence that we have here in the yellow was some work that I had initially started when I first moved here to New Brunswick. And so we had been able to estimate that, in fact, the rate in New Brunswick is among the highest rate across the country. And this is represents sort of the incidence. I apologize, I should have written that somewhere here. The incidence of multiple sclerosis, indicating the number of new people per 100,000 population that get it annually. And so multiple sclerosis, while very common in Canada, is still considered a rare disease, thankfully. So some of my initial work also described the distribution across New Brunswick. And so this gives you a sense of the incidence of MS in New Brunswick over 14-year periods from 2001 to 2014. And we can see that there's a bit of a distribution across the province as well. In fact, we see that Campbellton has among the highest rates, but we have to remember that the Campbellton region is smallest as compared to the rest of these regions as well. But in fact, when we looked more closely, we did identify that there was an evident difference when we look at the East Coast as compared to the more inland parts of the province, including St. John. And so this is demonstrated here, that the lowest rates that we identified of multiple sclerosis were in Bathurst, Miramichi, and Moncton. So along the coast, whereas the other areas had among higher rates in the province, but they kind of clustered into those two kind of groups. So what could be predisposing individuals to getting MS? I mentioned already the latitude and the residential location. So where you live seems to have an impact. The most implicated risk factor is EBV, which is a specific virus that most of us are actually exposed to. But one of the telltale signs of this specific virus in some individuals is the disease mono, which most of us are familiar with. So if you had mono, you probably know you had it. Most of you probably don't know you're exposed to EBV. But individuals with mono do tend to have a very high likelihood of having multiple sclerosis as well. Vitamin D and sun exposure are two risk factors that have been associated as well. Sun exposure was actually the focus of my PhD work. Body size, so higher body size, larger body size equals more MS. Sorry, I should have said less vitamin D and less sun exposure equals more MS. Smoking exposure has also been shown to be associated with multiple sclerosis in several studies. And then the purpose of this presentation here today, and one novel type of risk factor that had only been recently looked at, was the aspect of air pollution. So what evidence do we have for air pollution? There's several studies that have looked on specifically air pollution in urbanized types of areas. And we do know that MS is associated with movement or relocating to an urban area. So there's some old literature that identified when individuals moved from rural to urban areas that they tended to be at higher risk than those individuals who remained in the urban area, in the rural areas. And of course, we have to consider potential caveats with that as well, because if someone has a specific chronic condition, they may be more likely to move to an urban area where there's more services and resources, for example. So that might be confounded, but it does lend itself to the potential for air pollution to have an impact, possibly on multiple sclerosis, because air pollution has been shown in many research studies to have impacts on different aspects of our immune system, as well as on different aspects of our brain function, and the important relationship between the immune system and brain function. And so there have been several studies that have looked at the prognosis, so how disease progresses in multiple sclerosis, and there is evidence to suggest that having exposure to more air pollution equals more disease progression. But in terms of having the predisposition to have MS, the results are less consistent, and also not as many of them. So this led us to sort of conduct or start to look at this question here in New Brunswick, at least. So the research objective was to explore the association between air pollution and multiple sclerosis in New Brunswick. Just getting into our methods. So as Jennifer mentioned, and I mentioned at the beginning, I am a research associate at NB-IRDT. And so what we do, we conduct objective, rigorous, and evidence-based research and program evaluation. And a lot of our work is done to support G&B planning and policy development. We hold large number of data sets, administrative data sets that we receive from G&B, but also from RHAs and many other types of organizations across New Brunswick. And we house these data in a secure facility in 3 sites across the province, and we are data custodians. So we make these data available to individuals who want to use them, of course, through a rigorous process of approval, but then we are able to also combine data from other individuals to combine with the many data sets we have. And so the work was done within the Institute, where we were able to use several data sets that were available. Air pollution is one of the data sets that is available, accessible through NB-IRDT, and you can also find it and access it outside of NB-IRDT using the URL that I've posted here. So we received these data from CANUE, which is the Canadian Urban and Environmental Health Research Consortium. It's a great consortium that has amazing data availability. So if you're interested or have a need or know anybody, this would be a great resource for them. The data are provided free. I'm pretty sure, I don't know if there's certain stipulations depending on where you work, but for us, at least at UNB, they are free. And so we get to use these, and we requested 4 pollutants specifically for this presentation, but they have many, many different other metrics that are really a great interest as well. So I would suggest that you just search it if it's of interest to you. So we look specifically at these 4. So particulate matter less than 2.5 micrometers. So particulate matter is just like stuff in the air. So when you see like dust particles through a stream of light that's coming through the window, that's kind of what what's being captured in terms of particulate matter. So stuff in the air, but it's small stuff. So stuff that's smaller than that 2.5 micrometers. We also looked at nitrogen dioxide, sulfur dioxide, and ozone. And so these pollutants have somewhat different sources, but can also have different impacts on human physiology. And so we wanted to start to look at some of these and how they might impact multiple sclerosis. And so CANUE provides data, long-term air pollution exposure. So there's other data sources that provide short-term air pollution exposure, but these are long-term measures. And they are provided for each postal code in New Brunswick. So we can identify individuals where they live and then assign a pollutant level to them. And these pollutant levels are derived using satellite data and regression models. So they're pretty complex technical approaches to deriving the pollutant levels that have been extensively validated. So we got our pollution, so what we're interested in as our exposure, and now the outcome that we're interested in was multiple sclerosis. So we had to identify people who had multiple sclerosis. So this case identification algorithm that we used was the Canadian Chronic Disease Surveillance System, which I'll probably, in most cases, just call CCDSS. So if you hear that, that's what I'm referring to. And so what the CCDSS does is it links administrative data sources in a consistent and a comparable way across jurisdictions. So in New Brunswick, in Nova Scotia, all the way to BC, that we're doing things in a similar way that allow us to be able to compare across jurisdictions. And these are done routinely so that they provide for timely reporting to support planning and policy evaluation. And so the CCDSS algorithm is based on 3 or 4 here data sets that we have at NB-IRD, for example. And these administrative data sets include a registry, which have a unique identifier that enables us to link across different data sets, but the health registry identifies individuals who reside in a specific location. For specifically, the New Brunswick Healthcare Medicare Registry is what we use for this here in New Brunswick. And then using several other data sets, diagnosis types of data sets that would allow us to identify among individuals who live in a specific area, do they have the diagnosis we're interested in or not? And so hospitalizations are one, physician visits are another, and prescriptions are another. And so the CCDSS MS case algorithm requires an individual to have 1 hospitalization that has been coded with an MS diagnosis, or 5 visits to a doctor, any type of doctor, in a 2-year period. So if someone satisfies that, then we define them as having MS. Okay, of course, that's not a clinical diagnosis. So it's just using information that we have available to us. And so several groups have now gone and validated this algorithm to see how good is it. And the sensitivity tells us how good it is at capturing people who actually have MS. And it's pretty good at doing that. Sensitivities in the range of 80 to 90% are usually something we say are pretty good. Specificity means that we're not capturing people who don't have MS in the sample. So like other conditions, maybe other neurological conditions, certain things that might be similar to MS, but not MS. And in fact, we're not really capturing any of these individuals. And so the algorithm does a really good job of ensuring they don't make it in, but we are missing some of the MS cases, of course, because the sensitivity is also not perfect. Other people have created other algorithms. So, one algorithm may not be good as another algorithm, but CCDSS has chosen this algorithm, but other people have explored other algorithms, which I've mentioned just a few here. So when we identify the pollution and the individuals, now we have to say, okay, well, we need to assign a pollution level to an individual. Where do we do that? Well, we chose to do it where they live, where they reside. So we did this with our Medicare registry, or which we call the citizen database, and it includes all residents of New Brunswick who've applied for a Medicare card. It includes information about their basic demographics, the time eligible, like if they left the province or they were returned to the province, as well as information on where they live in the province. And so we use this information to identify a location, and then we're able to assign the air pollution to the postal code of where the individual resides. So our study design was an ecological study design. So this is different, a different type of study design than you might be more used to seeing. Ecological study design is a study design that happens at the area level. And so the areas that we used are these New Brunswick Health Community Council communities, or which I've called here HCCs, and there's 33 of them across New Brunswick. And so what we did was we aggregated individuals that lived within these HCCs and aggregated the air pollution levels within these HCCs, and then related these two variables in order to identify whether there was an association between the pollutant level in that HCC and the MS prevalence in that HCC. And we chose to do this in 2011, and we used ArcGIS to do the mapping, and analysis was done using SAS. So all our associations that we were interested in describing here are the associations between the average pollutant level at the HCC level and the MS prevalence at the HCC level. And so the ecological study design is often a design that's used when certain data aren't available. And so it limits the ability to do an individual level analysis, which would assign a specific air pollutant to a person and not an area, for example. So our research hypothesis was that HCCs that have higher pollutant levels will have higher MS prevalence. All right, so what did we find? So this gives you a bit of an idea of the variation in air pollutants in New Brunswick. So we saw some regional variation observed in air pollutant levels across the province. In some areas, you can see are more red. The darker red indicates the highest level. We created these maps to bin areas into one of 5 areas. So the lightest color is the least polluted. So you may expect some areas to be more in the province to be more polluted than others. Of course, we know that urban areas or more urban areas tend to be higher air pollution than less. And so we can see St. John, I don't know if you can see my cursor, but St. John and Moncton, you know where those are, tend to have certain higher levels of particular pollutants. Just to note that all the pollutant levels that we observed are lower than established air quality standards for Canada. So as we know, air quality in New Brunswick is quite good, and also quite lower in New Brunswick than we would observe in other areas of the country, in terms of especially specifically urban centers in other areas of in Canada. So this gives you a schematic of the variation in MS prevalence. And I guess I should have said, like, the variation in air pollution wasn't so substantial because it was all quite low. And in terms of MS prevalence, again, the map here gives you a sense of that. So areas with dark red have highest prevalence of MS, so the highest number of individuals living with MS per population, and the lighter colors have lower levels of MS. And so as I had shown earlier, with respect to the incidence data, the levels in the coastal HCCs are lowest, whereas the areas within inland appear to be higher. And the same goes for prevalence. Incidence and prevalence are highly related. So what we found in 2011, that there was 1,532 prevalent MS cases, which gives us a prevalence of 261 per 100,000 individuals, which is among the highest that has been reported in Canada for a prevalence. But we did observe that prevalence varies greatly across New Brunswick. So in areas with the light colors, their prevalence is less than 100, or close to 100, whereas the dark areas, their prevalence exceeds 350 and is quite high. So we do have some pockets in New Brunswick that have very high rates of multiple sclerosis, and I've just made a note here in terms of the ranking, which were the highest and which were the lowest. Okay. So the associations between the pollutant levels and multiple sclerosis prevalence. So what we found was the HCCs who have higher particulate matter, or that stuff in the air that was small in size, have a higher MS prevalence. And so when we considered the pollutant levels alone, PM2.5 was shown to be significant, as well as nitrogen dioxide, which is NO2. When we consider all the pollutants together, only PM2.5 was found to be associated with multiple sclerosis. And so the figure that I presented here at the bottom gives you those results when we considered a multi-pollutant model. So a model with all these 4 pollutants together to be able to describe which of them, if any, of course, have an impact on multiple sclerosis. And so what we found was that PM2.5 was shown to have an increase, shown to be associated with an increased risk of multiple sclerosis. The prevalence ratio here says it's 1.59. So what does that mean actually? So that means that when we compare an area in New Brunswick that has a pollutant, PM2.5 pollutant level that is 1 microgram per meter squared higher, and the microgram per meter squared is the way that PM is measured. So it's sort of the volume of it, how much of it is. So if an area, an HC has a higher PM2.5 level by 1, we would expect that their prevalence of MS will be 60 times higher than that original HCC. And so that gives us a sense that PM might be having an important impact on multiple sclerosis here in New Brunswick. And we assess the results to see if they were impacted by age, sex, and income. And the results for PM2.5 remain significant when we looked at those confounding factors as well. Okay, so in summary, all 4 pollutants were considered, and only PM2.5 was associated with a higher prevalence of multiple sclerosis. PM2.5 is suggested to negatively impact the immune system function and impairs the integrity of the blood-brain barrier. So the blood-brain barrier is our protection from the outside world for our brain and our spinal cord, so anything in our central nervous system. And the exposure to air pollution has been found to reduce its ability to act as a barrier in order to reduce infiltration, but also in terms of immune function at that brain barrier, its ability to maintain a healthy immune function system there. So in terms of strengths of this work, we have large population-based data sources. So we searched millions of people in order to identify these MS cases. The data were prospectively collected. We used very detailed air pollution data that's derived in very sophisticated modeling approaches. And we use a validated case definition to identify MS cases, which has been shown to be very good. However, of course, there's always limitations when it comes to research. Main limitation is that this is an area level analysis, so we cannot be confident that this is a causal finding. It is a first step in looking at this question here in New Brunswick. And when we look at ecological studies, ecological fallacy bias is something that is always brought up, and so we must consider potential biases in this analysis. The algorithm, of course, while great and shown to be very good at identifying cases, it's not a clinical diagnosis, so it's not a gold standard. And we have not tested here in New Brunswick yet, so we're not sure how it could perform. But lending data from Ontario and from Saskatchewan, we can hope that it's pretty good here as well. And a main limitation is why we had to go with the area level analysis is that with the CCDSS data, we actually can't define when the disease started. And so having a disease start date allows us to assign an air pollution level prior to that date. But unfortunately, with multiple sclerosis, doing this type of risk factor research is also difficult because when individuals are diagnosed with multiple sclerosis, so their first exposures, I guess, to the healthcare system related to their disease, often what we see on MRI is that they've got disease activity that has been under the surface. And actually, that's one of the hypotheses as to why men or males tend to have a diagnosis later, is that the disease is subclinical, and whereas in women it becomes clinical sooner in time. So there's a lot happening under the surface before any physical impairments or other types of impairments are noticed. All this to say that we found some evidence of association, and so the results do warrant a closer look using an individual level exposure assignment, so identifying individuals with MS and identifying when their disease began, so we can assign exposures at an earlier point prior to their diagnosis, and employing sort of a population-based cohort study where we can follow individuals forward in time. So that summarizes the work that we've done on air pollution and multiple sclerosis here in New Brunswick. We're wrapping up a publication right now to have submitted to a multiple sclerosis journal, but some of the work will be ongoing as well. So I thank you, and I welcome any questions if you have.